Ashley, and I'm your nurse for today. To begin, can we go ahead and just have you verify your name and date of birth?
Monica Beecham.
Thank you, Monica. So I would pull the curtain and the door is shut. So I see that today we are here to do a basic assessment physical for you, is that right?
Yes.
And how are you doing today?
Great.
Good. So right now I'm just performing a general safety check of the room. I don't see any cords. The wheels are locked. The rails are up. So I'm going to go ahead and get a set of vitals on you today.
Okay.
So with your assessment, we'll go ahead and we'll start by looking at your eyes. But before we begin, can you just tell me if you have any allergies to any medications?
No.
Okay. And what about current medications that you're on? Any?
No.
And any past medications we should be aware of?
No.
And what about surgeries or hospital stays?
No.
Great. And then, do you have any concerns today? Any problems?
No.
Okay. So we'll go ahead then, and we will start out with your assessing your eyes. Is that okay?
Mm-hmm.
So I'll just have you close for a minute. Okay. Open. Great. Open. Perfect. And then let's go ahead and just follow this with your eyes. Perfect. Your pupils are equal, round, responsive to light, and accommodation. Perla, that's great. Can you tell me about any pain you're experiencing today?
No.
Okay, and if you were, I'd ask you on the scale of 0 to 10 how you were feeling. Let's go ahead and see your awareness. So where are we at today?
Still College campus.
And do you know what time it is?
It is almost 1 o'clock.
Great, and who's the president?
Biden.
Perfect. And while you've been talking, I noticed that you're not slurring. If you can smile for me, it looks symmetrical. There's no drooping of your face, so that's great. So now we're gonna go ahead and do an assessment on your forehead. Is it okay?
Mm-hmm.
Okay. Tell me if you have any pain here. All good?
Mm-hmm.
Check your sinuses. All good?
Mm-hmm.
Great. And then I'll go ahead and just move on to your ears, nose, and mouth. So if you can just go ahead, we'll start with your nose. Perfect. And then open. Say ah.
Ah.
Great. And then we'll look at your ears. And if you can turn toward me. Thank you. Okay, so now we're gonna go ahead and assess your chest. Have you had any chest pain?
No.
Okay, and I'm visualizing it. Everything looks good. I don't see any lumps or bumps. The color looks great. I don't see that you have any struggling for breath or anything. So we're gonna go ahead and listen to your heart, okay?
Okay.
And I'll just have you slide your badge. Thank you. So we're gonna start with your heart and we're gonna listen to the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Now the mitral is your PMI, so I'm gonna go ahead and listen to this for 1 minute to assess your rate and rhythm. Wonderful. That sounded perfect. I didn't hear any abnormalities there. So now we'll assess your lungs. Do you have a cough or do you have any difficulties when you're breathing, such as wheezing or anything?
Nope.
Okay. So if I can just have you sit up for a minute. I'm just going to assess the equalness. Can you go ahead and breathe in? Perfect. That looks equal there. So we'll go ahead now and we'll listen to the 6 spots today, okay? Big breath in and out. Perfect, thank you. And let's look at the same for your back. Your lungs sound great. I don't hear any crackling or anything like that, no wheezing, and everything looked equal to me. So now I'm also visualizing the area and I don't see any stridor or struggling for breath or anything. So it looks great, skin color still looks awesome. So now if it's okay, I'd like to move down to your abdomen to assess that today. Do you have any tenderness or pain in your stomach? No. Okay, so we're gonna go ahead and listen to the 4 quadrants of your stomach. Perfect. Thank you. That sounded good. Normal bowel noises there were heard. So now I'm going to go ahead and if it's okay, I'll palpate each one. You tell me if there's any pain, okay? Great. I didn't feel any lumps or bumps. That all looked good to me. The skin still continues to look good. I don't see any wounds or anything like that. How about your bowel movement habits? When was the last time you had a bowel movement?
An hour ago.
Okay. And would you say that they're pretty consistent and regular? Okay, no diarrhea, anything like that?
No.
Okay. And when you eat, are you having any nausea or vomiting with that?
No.
And would you say you're able to finish your meals okay?
Yes.
Perfect. So now, just in partner with that, let's just review your urinary habits. Any pain when you're urinating or anything? No blood in your urine or burning?
No.
Okay. And I don't see that you have a catheter, so that's great. So we'll go ahead now and just assess your skin here. So we're going to start over here. I'm assessing the color, the temperature, sugar. Perfect. Do you have any pain in your joints or body at all? Okay, perfect. I don't see any edema or swelling, so I'd like to go ahead and get your pulses. Perfect. They're equal, strong, no concerns there. So I'll go ahead and move down to your legs. I'm assessing the color, no edema, sugar. Everything looks great there. Let's go ahead and do your reflexes. You can just push against me. Perfect, and then go ahead and pull. Great, very good. We'll check your capillary refill here. That was great. And we'll check your capillary refills on your fingers as well. Looks good. We're gonna go ahead and just check this dorsal pulse. Perfect, those are equal and strong as well. So I've assessed your skin. I noticed that when you walked in here today that you were walking perfectly. Do you have any pain or struggle when you're walking? Okay, great. So your gait sounds perfect. And I noticed that you don't have any IVs or oxygen. If you did, I would check the flow rate for your oxygen. I'd check your IV for any redness or swelling, pain associated with that. You don't have a catheter as well. So everything looks good. I'm gonna go ahead and just get this all documented in your chart. Do you have any questions for me before I go? Okay, well, thank you for your time.